Welcome to our fourth installment of this series. I know folks kind of trickle in at the beginning, but I'm going to go ahead and start with the spiel so we can get going. Really excited for today's session. So again, thanks everyone for joining us for session 4 of our series, Take Care, Demystifying Insurance and Care Options for Independent Arts and Culture Workers. I'm very excited for our fourth installment today, which is titled Every Teaching Artist Insured, Understanding Your Healthcare Options. My name is Kinsey Keck. I use she, her pronouns. I am a white woman with brown hair. It's pulled up in a ponytail. I'm wearing some large, round, wire-framed glasses and a black, dark green, and white tie-dye kind of sweater. And I'm sitting in front of a white wall. And you can kind of see my kitchen over my shoulder as well, and a very cute Santa cookie jar as well, which I love. I'm also the programs director here at the New York City Arts and Education Roundtable, which is a grassroots service organization that works to improve and advance the state of arts education in New York City, New York State, and beyond. Although we are currently meeting online today via Zoom, the Roundtable would like to, again, acknowledge that we do work and live on unceded lands. Mannahatta, or the place that is also widely known as New York City, exists on the contemporary and ancestral homelands of the Canarsie, Munsee, Lenape, and Wappinger people. These sovereign nations and communities are still thriving here, and we continue to occupy their lands. We would like to give a moment of respect to them, as well as to the Black and immigrant communities, which have helped build the city that we know today. As we recognize that all of our pasts, presents, and futures are intertwined, I'm again going to uplift a handful of contemporary Indigenous arts organizations that I feel we can all support and learn from. So if you haven't had a chance yet, please save these links, do some research on these organizations, support them with donations if you can, or do the same research and work for the area that you're in, if you're not in the New York City area. I also invite anyone to share links to highlight any other Indigenous arts organizations that they know of in the chat to share with everyone on the call. Thanks. So just a few reminders. If you are having trouble with Zoom at all today, you can just send me, Kinsey, a private message. I'm here to help. Please keep your mic on mute so that we can hear whoever is speaking. I encourage you to use the chat to connect with folks on the call, share links and thoughts, also to share your questions. We will be collecting all of your questions and holding them till the end for a Q&A portion. So if it's not addressed immediately when it comes up, fear not, I will be collecting those questions and we will get back to them at the end of today's call during the Q&A. This call does include closed captioning. To activate your captions, click the captions button. It's either on your toolbar or it might be under those 3 dots, that more section, and then you can select show captions and you have some settings there as well. And this session is being recorded. It will be made available to registrants after the closing of the series, along with all the other videos. I will be sending you one email with all of that and all of the fabulous resources that come from this week that will come to you likely next week or maybe the week after, depending how long it takes us to get everything uploaded. But you will receive all of that. I think that is enough for me. Thanks for listening. It's my sincere pleasure to turn it over to our facilitator today. Please join me in welcoming Renata Marinaro. Renata is the Managing Director of Health Services at Entertainment Community Fund. Welcome, Renata. I'm turning it over to you. Thanks so much for being here.
Thank you so much, Kinsey. Really appreciate that. Thank you also for the resources that you put in the chat. That's really wonderful. My name is Renata Marinaro. I am Managing Director of Health Services for the Entertainment Community Fund. I use she, her pronouns. And I'm going to be helping you guys understand the health insurance landscape today. At the end of this presentation, I really hope that everybody is a certified health insurance ninja. I think that my goal is to really create educated consumers. So what we're going to do today is we're going to start out with a little bit of basic vocabulary so that you understand, what a deductible is versus an out-of-pocket maximum. These are things that often get confused. We're going to talk about what your rights are as a consumer, because thanks to the Affordable Care Act, you do have them still. We're going to talk about when you can enroll. We're going to talk about what kinds of things are covered. And in the middle, we're going to talk about how you estimate your income. And that is probably one of the most important things to understand so that you get the most bang for your buck. In the second half of the presentation, we're going to talk about Medicaid, the essential plan, and marketplace plans, and how to find a plan that works for you. At the end, I'm going to talk about what to do if you're uninsured. So we don't want you to think that you have to have insurance in order to get health care. It is better for you because then you don't have the potential of, hundreds of thousands of dollars worth of bills, but you can get healthcare without being insured. I want to be clear about that. And so we'll talk a little bit about what that looks like, how to lower your drug costs, and how to lower your hospital costs if you do end up being uninsured for some reason. As Kinsey said, we would love it if you stay muted during the presentation. Background noise is always kind of weirdly distracting, and I am thrilled to answer all of your questions. As Kinsey said, you can put them in the chat and we will answer all of them at the end. Do not worry, we will have absolutely enough time for everybody's questions. All right, I'm going to get started. Just a little bit about the Entertainment Community Fund. We are a national human services organization that helps everybody in performing arts and entertainment. We're really the 911 and the 311 for the entertainment industry. So we're here to provide a safety net and also to encourage stability and resiliency over your lifespan. The Artist Health Insurance Resource Center is one of the programs that we run here, and it's really designed to help people navigate this crazy, crazy system that we have. So we do these kinds of online seminars with live Q&A. This one is for people under the age of 65. So we will not be talking about Medicare during this presentation, which is for people 65 and over. If you do have questions about Medicare, you can come to our Welcome to Medicare webinar, which is every Monday at 1 p.m. We offer free consultations and enrollment assistance from experienced, unbiased application counselors. So these are people that have no financial motive to give you the wrong advice. They are really just here to help ease your way through the system, help you understand how to navigate your income, or estimate your income, I should say, and pick the plans that are right for you. And I'll talk a little bit about how to get an appointment with one of those people in a few minutes here. We also do online educational materials. So you can see this is a screenshot of one of our healthcare tutorials. We have these on YouTube, but if you go to entertainmentcommunity.org/AHIRC, that's entertainmentcommunity.org/AHIRC, you will see the healthcare tutorials, and you can click on them. They're 3-minute cartoons that go over things like, what is Medicaid? What is Medicare? How do I lower my dental costs? How do I lower my drug costs? Those kinds of things. And finally, we fight to make a more consumer-friendly system. So we work legislatively in New York State to encourage legislators to make insurance more equitable, fair, and affordable. One of the things that we've done is we've successfully expanded what's called the COBRA subsidy, which I'll talk a little bit about later. All right, so let's talk about some basic words and get that out of the way so we're all on the same page. So a premium is a subscription to your insurance. It allows you access to health insurance. It's basically what you pay every month, sometimes quarterly, just to have it. A deductible is what you pay upfront in medical expenses before the insurance company starts to pay their share. So you can have a deductible that applies to all the benefits on your plan, or you can have a deductible that applies to only certain benefits on your plan. You have to look at the plan in order to know which one you have. But let's say that you have a deductible that applies to all the benefits on your plan. And let's say that deductible is $1,000. In that situation, you are spending the first $1,000 out of your own pocket for any kind of medical expenses. Maybe that's $250 for an office visit, $500 for lab work, another $250 for some kind of medication or cream that the doctor prescribed. If you add all that up, that's $1,000 out of your own pocket. And once you've paid that deductible or satisfied that deductible, then you don't have to pay full price anymore. Then you're paying a copay or co-insurance. A copay is a flat fee. $25 to see your primary care physician, $40 for brand name medication. That's a copay. You know what you're going to pay in advance. Coinsurance is a percentage of the bill. So if you see 20% or 30%, that's what you're paying. That's your portion of the bill. The insurance company is supposed to pay the rest. Coinsurance is generally a worse deal for the consumer than a copay because you don't know what you're going to pay when you walk through the door. That's one of the very weird aspects of our system. So if you go to a doctor and you have an office visit scheduled and you think it's just going to be a routine visit, maybe you're going to see this person for 10 minutes and you end up with a 30-minute office visit, that's going to be charged at a different rate. And so if you know going in that you have 20% coinsurance, you still don't know what you're going to pay, right? Because maybe you thought 20% of a 10-minute office visit. Now it's 20% of a 30-minute office visit, which is more expensive. So coinsurance is harder for consumers to understand. There's less transparency. However, most policies have copays for certain things and coinsurance for other things. So often you have copays for lower cost things like office visits, lab work, etc., and coinsurance for more expensive stuff like hospital stays, CT scans, those kinds of things. The out-of-pocket maximum is the most that you're going to spend in a year if you're insured on medical costs. This is important. So this is a cap. It's a stop loss. Again, this is only if you're insured. It's a stop loss, and it says, you know what? If you follow the rules of your insurance and you pay your monthly premiums and you end up in the hospital with a $250,000 bill, the most you're going to spend in a year for medical expenses, and this includes your deductible and any copays or coinsurance, is $9,450. In-network and out-of-network relate to HMOs, EPOs, and PPOs. These acronyms they stand for different types of insurance policies. So an HMO and an EPO are in-network only policies. What that means is that you have to go to the doctors and hospitals and labs that your insurance company has contracted with. And in order to figure out what those are, you're going to go on their website and you're going to click on a button that probably says find providers or find doctors or find facilities or something like that. If you have an HMO or an EPO, you're going only to the doctors that are contracted with your insurance company. If you have a PPO, you have more freedom. You can go to doctors that are in your network. You can go to doctors that are not contracted with your insurance company. PPOs are more expensive. They allow you more freedom. And here's the bad news. You can get PPOs through unions. You can get PPOs through jobs. You cannot buy a PPO on the New York marketplace. So anything that you are looking at on the New York marketplace is going to be an HMO or an EPO. The federal poverty level is what the government thinks you can live on, which you can see how, if you hadn't noticed already, you now know how out of touch they are. So nobody can live on this. This isn't rent for anybody in the entire country, let alone New York City. The reason why I bring this up is because this number is very important when we're talking about your insurance premiums. So where your household income is in relation to this number will determine what you pay for health insurance. In New York, if you are at this number, $14,580, you're going to have free insurance. If your income is double that, you're going to have free insurance. If your income is 3 times this amount, you're going to pay. It's going to be lower, but you're going to pay. The more your income increases, the more you're going to pay for insurance. But this is what it's based on. The marketplace and the exchange are the same thing. It's a website that you go to look at your insurance options and enroll in them. And the advanced premium tax credit is just that. There's nothing Orwellian about it. It is a tax credit that you get in advance to lower the cost of your insurance premiums. And we will talk in detail about it in the second half of the presentation. All right, we're going to move on and we're going to talk a little bit about what your options are. The cool thing that we do at the Artist Health Insurance Resource Center is that we have the broadest overview of all of your options. So most people might go to an insurance broker. Those are people that contract with certain insurance companies to sell their products. When you go to an insurance broker, you're not paying. The insurance company is paying them to sell you something. Problem with that is that a lot of brokers, most brokers, don't contract with every single insurance company. So they're only going to tell you about the policies that make them the most amount of money. Another option is, let's say you decide that you want to apply for a public program like Medicaid. You go to the Medicaid office. Those people are not going to know anything about private insurance, right? So there's like these different buckets in the healthcare coverage world. And we have the broadest overview. So we understand what your private insurance options are and what your public insurance options are. And that's what we're going to go over here. So these are your options. If you are getting insurance through a job or union and you're losing it, you're going to have the option to go on COBRA. And I'm going to talk about that next. You can buy insurance directly from an insurance company. I do not recommend it. You can go to the marketplace. I do recommend going to the marketplace because they will sell you regulated insurance and they'll give you a discount based on your income. And it's also fluid. So if you make more money, you let the marketplace know, they're going to charge you more for premiums. If you lose your job in the middle of the year, you're going to let the marketplace know, and they're going to charge you nothing for premiums if you have no income. You might also be eligible for Medicaid or the Essential Plan, and we will talk about all of these things in great detail. All right, so COBRA is a law that lets you keep your employer or union-based coverage for 18 months after you lose it, and sometimes longer. You have 60 days to choose COBRA and 45 days from the date that you choose COBRA to pay your premium. But you have to back pay to when you were first eligible. So let's say you're losing insurance at the end of next month, at the end of December. At the end of February, decide that you want to go on COBRA. You're going to have to back pay to January 1, which was when you were officially eligible for COBRA. COBRA premiums are expensive because they are equal to the full cost of your health insurance. So most people, if they get insurance through an employer, their insurance is being subsidized by the employer. It's pretty common for the employer to pay for 60 or 70% of your insurance premiums when you're employed, sometimes even more, sometimes 80%. And then you pay the difference. But when you're on COBRA, you're paying 100% of the insurance premium, and that can be a lot. If you get insurance through an entertainment union health plan, SAG-AFTRA, Equity, IATSE, Musicians, Local 802, any of those, and others as well, any entertainment union health plan, and you're losing your coverage and you're eligible for COBRA, you might be able to take advantage of this really great program called the COBRA subsidy. This is designed for New York-based entertainment workers who are on entertainment union health plans. It reduces your monthly premium payments to 25% of your normal costs. So the state is paying 75% of your monthly premium, which is amazing. And you can keep that for 12 months. In order to be eligible, you have to live in New York, and your income in the prior month has to be below $4,530 for one person or $6,103 for two people. That is gross, and that's all income. So they're only looking at the prior month. So let's say that you are losing your insurance at the end of December. You're going to apply in January, and you're going to show them December's income. And if you're eligible, then they will approve you in January, and they will pay 75% of your insurance premium for the next 12 months, and you will pay 25%. If you would like to download the application for this program, you can go to our website, entertainmentcommunity.org/AHIRC. All right, so let's talk a little bit about your rights as a consumer. So insurance companies cannot refuse coverage to anyone or exclude pre-existing conditions. This is a really big deal. This happened thanks to the Affordable Care Act. It was not in place before then. There's no penalty anymore for being uninsured in New York and most other states, but there is still a penalty if you live in New Jersey, as well as a few other states here, Rhode Island, Vermont, Massachusetts. So just keep that in mind. If you live in New Jersey, you cannot be uninsured for more than 2 months. Once you're uninsured for more than 2 months, you'll pay a penalty on your tax returns. Most plans must cover preventive screenings for free. Preventive screenings are things like mammograms, colonoscopies, pap smears, etc. Insurance companies also have to cover certain tests like cholesterol tests. They have to cover vaccinations, flu shots. The reason why your COVID vaccine was free is because of the Affordable Care Act. I want to make a distinction here between preventive screenings and diagnostic screenings, which is something that a lot of people don't know. So a preventive screening is what you get because the government says you're supposed to get a mammogram every year after age 40, or you're supposed to get a pap smear every year after age 18. You get them not because you have symptoms, but because basically they're telling you that this is a good idea. That's a preventive screening. If you're insured, those are required to be free. Diagnostic screenings are not required to be free. They may be free, but they're not mandated to be free. A diagnostic screening is when you find a symptom and you go to the doctor and you say, I need to get this checked out. Okay. Medicaid was also expanded. So Medicaid is a really great program that is free and very comprehensive. And in 40 states now, if you make less than $20,000 a year, you're going to be eligible for Medicaid. There are 10 states that decided not to go with the program. They are Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wisconsin, and Wyoming. North Carolina is actually in the process right now of expanding Medicaid. So that's unfortunate for people in those states. But in New York, New Jersey, and 40 other states, if you make less than $20,000 a year, you're getting free comprehensive insurance. I mentioned earlier about buying directly from an insurance company and that I don't recommend it. The reason why I don't recommend it is because you are more likely to get junk insurance and the policies are going to be more expensive. So they don't care what your income is. An insurance company is going to charge somebody making $20,000 a year the same price as somebody making $200,000 a year. They do not care. They also don't care if in the middle of the year you lose your job. They still want you to pay every month. So there's no point in going directly to an insurance company. You're going to get a worse deal and you're more likely to get junk insurance. And also you're dealing with agents who are incentivized to sell you certain policies, but not others. What is junk insurance? So junk insurance comes in two formats, faith-based share plans and short-term plans. Short-term plans are not legal in New York or New Jersey, but they are based in states like Georgia and Florida and Texas where they are legal. The Affordable Care Act only regulates insurance, health insurance that's 12 months long. Short-term plans are 3 months long or 6 months long. So you pretty much know it's going to be junk insurance if it's 3 months long or 6 months long. What they do is they say stuff like, we will cover hospitalization. And if you don't notice that there's a tiny asterisk next to that, then you assume that that means any hospitalization at any time. But what actually they're saying is that they only cover hospitalization on Tuesdays and Wednesdays. And that is not a joke. That is a policy that I have seen. So, they do all kinds of sneaky stuff. So I would definitely stay away from these short-term policies. Faith-based share plans sound lovely, but they are totally unregulated. So a faith-based community gets together and pools their money. And if somebody in the faith community gets sick, the idea is that they will pay for their medical bills. Sounds great. In actuality, they are more likely to pray for you than they are to pay for you. So what happens is that they have all kinds of exemptions and exclusions. they don't have to play by Affordable Care Act rules because they're not health insurance. They are legally and technically not health insurance. So they can say, oh, you had this before, so we're not paying for it. Or you didn't live by certain Christian lifestyle guidelines, so we're not paying for it. Or we don't cover medications or whatever. They can do whatever they want. They are unregulated. So stay away from these plans. Red flags are, of course, if they're 3 months long or 6 months long, any membership fee mention, any mention of membership fees, and if they say they're not major medical. So there's a time of year to enroll in insurance. I know that sounds weird, but we are in it right now. It's called open enrollment, and it's from November 1st to January 31st of every year. That is in New York and New Jersey. In other states, it goes from November 1st to January 15th. When the Affordable Care Act first rolled out, it was actually November 1st to December 15th, but that's been extended. New York has had continued open enrollment since COVID started. So actually, if you live in New York, you're in open enrollment and have been since March of 2020, and they are going to continue open enrollment until May of next year. The New York Marketplace website is nystateofhealth.ny.gov, and the New Jersey Marketplace website is nj.gov/getcoverednj. I'm just going to repeat that again. So New York Marketplace, nystateofhealth.ny.gov, and the New Jersey Marketplace is nj.gov/getcoverednj. If you live in New York, you're going to go to the New York Marketplace. If you live in New Jersey, you're going to the Jersey Marketplace. If you would like help in this process, we have fabulous navigators and assisters that do not work on commissions. They are employed by us, trained also by the state, and they can help you with all of your questions about income and plans and what to choose, etc. You can request counseling from our navigators by going to entertainmentcommunity.org/AHIRC and clicking on the link that says complete the short form. Now we are in our busiest period, so give us about 3 business days to get back to you. All right, so a little bit about special enrollment periods, because sometimes people come to these things knowing that they're going to lose their insurance outside of open enrollment. So in that situation, if you're going to lose your insurance, let's say you're in New Jersey and you know you're going to lose your insurance in February. That's outside of the New Jersey open enrollment period. So in that situation, if you're losing your insurance based on one of these things here, you have 60 days to enroll in insurance. So if you are losing your union coverage, job coverage, or COBRA coverage, if you're getting married or divorced, if you are pregnant or having a baby, if you're moving to another state or county, not within the county though, if you have a change in immigration status, like you get your green card, for example, or if you're turning 26 years old and aging off a parent's plan, these are all special enrollment events, and you have 60 days from the date of the event to get on other coverage. If you don't do it in the 60 days, you have to wait until the next open enrollment period, which starts November 1st of every year. There are other exceptions, because why make this straightforward when they can keep it complicated? So you can enroll in insurance at any time if you're eligible for Medicaid or the Essential Plan, if you're putting a kid on what's known as Child Health Insurance Program, or if you're buying insurance for a small business. FYI, for health insurance purposes, a small business is 2 or more people not related to each other. So it is not, unfortunately, a sole proprietorship. All right, so we've been talking about this marketplace. What's happening? What happens when I go to the marketplace? So the marketplace is going to ask you some questions. They want to know your household size and income. Your household is anybody you pay taxes with. So that's very important. It's not a domestic partner, and it is not a roommate. when they get your household size and income and some demographic information about you, they go step by step and they go, all right, let's see if this person's eligible for Medicaid. Let's see if they're eligible for the essential plan. Okay, they aren't eligible for either of those programs. They can buy a qualified health plan, which is just a name for regulated private insurance. How much of a tax credit are they going to get? So that's what's going on in real time as you're putting your information into this application. Before you start the application, you want to, of course, have your household information ready. So you want to make sure that you reflect everybody that's in your household, even if they don't need insurance. So if you, for example, have a spouse who is covered under employer insurance, they still have to be on the application and their income still has to be on the application, even though they don't need insurance. You're going to have all the demographic information that you could imagine. If you're an immigrant, you do need your immigration documentation. They're going to ask for the numbers from those forms. You also want to call your doctors in advance and ask them what they're in network with on the marketplace. And that's super important because, as we talked about earlier, all of these plans are HMOs or EPOs, which means you have to stay in network. So if you want to stay with your doctors, you have to find out what networks they're in. And one thing that people don't understand is that the marketplace has its own network. So you can go on the marketplace and you'll see Blue Cross Blue Shield. And maybe you're with Blue Cross Blue Shield right now through your employer. And so you think, oh, must be the same network. It is not. These insurance companies create separate networks for different employers, for different unions, and for the marketplace. So you have to be very specific and say, what are you in network with on the marketplace? Do not just say, do you take Blue Cross Blue Shield? You're not going to get any actionable information with that question. So you want to ask them, what are you in network with on the marketplace? The Affordable Care Act mandated comprehensive benefits. So regardless of whether you are eligible for Medicaid or the essential plan, which are free, or you're paying for a qualified health plan, all of these things are mandated to be covered. It's just a matter of how much they're going to cost, but they are covered benefits. Medicaid does not cover chiropractic care, but the essential plan and qualified health plans do. And qualified health plans, again, the plans that you're buying on the marketplace, will reimburse you for going to the gym on a regular basis. So keep that in mind. So if you go to the gym 50 times within 6 months, which is about a little more than twice a week, sorry, they'll pay you $200 every 6 months. So you can conceivably get back about $400 a year from your insurance company. Coverage of abortion now depends on state laws. In New York and New Jersey, abortion is a covered service under Medicaid, qualified health plans, and private insurance plans. All right, so we are in the middle of the presentation where we are going to talk about income. And this is really important, like I said, because this is going to determine how much you're going to pay for insurance. I know it's weird, but you're estimating future income, which is really hard to do, right? There's two ways you can do this. You can either use your most recent tax return or you can build your income. Using your most recent tax return is the easiest. And what happens there is that the system pings the IRS and says, oh yeah, that's what that person put on their tax return on line 11 last year. We're good. And they're not going to ask you extra questions. So it just makes it easier. You can only do this if you think that your income next year is going to be within 10% of what it was on your most recent tax return. So for most people, that's your 2022 tax return. You should take a look at line 11 of your federal tax return. That's your adjusted gross income. And that's what they want to understand. And if you think your income is going to be within 10% of that, use the number on your tax return. Because again, they're pinging the IRS. They're going, okay, that person put that number on there. We're going to ask them fewer questions. However, most people are not making what they made in 2022 when we were getting unemployment benefits and COVID benefits and all that kind of stuff. So most people's income is going to be different next year. You're going to only put in what you know you're going to receive. So this morning I was working with somebody and they had 2 jobs this year and they were released from one of them. So going into 2024, their income was going to look very different. So they were only going to put in the one job that they were going to have in 2024. Now he said to me, there's no way I'm going to be able to survive on just this one job. Can I put in how much I think I need to make to live on? And I said, no, because you only are going to put in what you know you're going to receive. It's not to your benefit to add to that. You can change it when it changes. So once this person gets another job next year, and once they've been paid, they're going to go into their marketplace account and update it. So maybe their income is going to go from 30,000 to 50,000. You can do that with your marketplace account. That's the really cool thing. Now, once they increase their income, they're going to be paying more for insurance as well. But conversely, if their income were to go away, they would be paying nothing for insurance. So you're going to estimate based on what you know you're going to receive, and you're going to update that information if it changes. They generally want gross income. So we're talking about pre-tax income. And that's for W-2 income, interest, unemployment benefits, all kinds of different things. Self-employed income is the only kind of income where you can deduct business expenses. But if you're self-employed, you should deduct business expenses from your income and put that into the application as well. Anything that would show up on a tax return needs to be included in your estimate. But you don't have to put in cash gifts. So if you have a very generous aunt or uncle or friend that's footing some of your bills, as long as it's under $17,000 a year, you don't have to put it on your application or on your tax return. All right. Now we're going to talk about Medicaid, the essential plan, and marketplace plans. So this is how you're going to get your health insurance. Medicaid is comprehensive health insurance at no cost to patients. That means there's no premiums, there's no deductibles, and there's only very small copays for drugs. That's it. And by small, I mean $1 and $3 for your medication. So it's really great. It covers you for 12 months. If you're eligible for Medicaid and then your income increases so that you're no longer eligible, you will still stay on Medicaid. Why is that? Because it's better and cheaper for the government to keep you on than to take you off and then get a bill from a hospital and try and figure out if you were eligible at that point or not. The bureaucracy is so much more expensive. So they just say, you know what, you're good for 12 months. You do have to let them know that your income's increased, but they will send you a letter that's confusing that says you're no longer eligible, but you're still staying on this program for 12 months. So if you're under 65, there's 2 ways to be eligible. You can be eligible based on your annual income or your monthly income. If you're under 65, they don't care about assets. They don't care about your savings, whether you have 4 houses or not. They don't care about any of that stuff if you're under 65. So you can be eligible if your annual income is below roughly $20,000 a year for one person or $27,000 a year for 2 people. You can also be eligible if your income in the current month is below $1,677 for one person or $2,268 for 2 people. What that means is New York is going to ask you both about your annual income and your current month's income. If you tell them my annual income next year is going to be $30,000, but this month it's $500, they're going to make you eligible for Medicaid. In New Jersey, you have to be eligible in the month you apply. So in New Jersey, it's slightly different. And New Jersey says, okay, great, we don't care what your annual income is, even though they will still ask you about it, but you have to be eligible in the month you apply. And we are talking about gross income here, not net income. So this is pre-tax, before taxes are taken out. The essential plan is a New York only plan for people who are just above the Medicaid income limit. So if you make between $20,000 and $29,000 a year as a single person, or just roughly $39,000 a year for two people, you're going to also get free comprehensive health insurance. Okay, so just sort of a reminder, anybody making less than $29,000 a year living in New York State can apply for insurance at any time and will get free comprehensive insurance. There are more copays on this program than Medicaid. So there's copays for everything, but they're very low. So it's, $25 to see your specialist, $15 to see your primary care physician, low copays. You have to be between the ages of 19 and 64. And just like with Medicaid, once you're eligible for this, if your income goes up after that, they're still going to keep you on it. There are a lot of people that are on the essential plan. I think in New York now it's close to 1 million, or maybe even over 1 million. If you're one of those people that was on Medicaid or the essential plan during COVID, you might be a little confused right now, because during COVID, and by during COVID, I mean between March 2020 and May of this year, they were auto-renewing people. They were not asking you to prove your income. They were just like, great, you're on it. Let's keep you on it. We want as many people on insurance as possible. So they didn't ask you to prove your income. They are doing that again now. So if you got a letter saying, hey, we need to understand your income, you do have to renew and you do have to prove your income. You can reach out to us at entertainmentcommunity.org/AHIRC, and we will help you through that process. If you don't qualify for free insurance, you can always buy a qualified health plan. Again, that just means regulated private insurance on the marketplace. I can't tell you what that will cost, and that's actually a good thing because it is so particular to your circumstance. It depends on what county you're in, how many people you want to insure, what your income is, what insurance company you want to go with, and what level of coverage you want. Most people are getting what are called advanced premium tax credits. These used to be a lot lower. They've become much more generous during the Biden administration. So you may have had contact with this system 5-10 years ago, and it will look quite a bit different because these tax credits have increased substantially. The advanced premium tax credit is the discount that you receive off the price of your monthly premium, and it's based on your annual income estimate and how it relates to the federal poverty level. These advance payments are made to the insurance company. So let's say that you find out at the end of the application that you're going to get $600 a month to pay for your insurance premiums. Let's say that you find a plan that costs $650 a month. You pay the insurance company $50 a month, and they get $600 a month from the government. If you're married, you have to file jointly to get this tax credit. You cannot be married filing separately. And it is a tax credit. So that means it has to be reconciled on your tax returns. So if you estimate a certain amount of money or a certain amount of income, and then you make more during the year and you don't update your marketplace account, they're going to ask you for the difference between what you got and what you should have got. In other words, if you said, I think I'm going to make $30,000 next year, and you end up making $40,000, and you didn't tell them that you ended up making $40,000, they're going to ask for the difference in the subsidy that you got between $30,000 and $40,000. So that difference might be $100 a month times 12 months. So that might be $1,200 right there. It is a reconciliation. It's not a penalty. They're not fining you. They're just saying, hey, you got a little bit more money than you should have. You need to pay us that back. Conversely, if you made less money, you will get money back from them. There is a button on the website. The New York State of Health website is horrible, honestly. Like, I don't know why they just, like, they need better marketing or something, because a lot of people go on it and they see these crazy prices, and there's a tiny button that says estimate financial help. Nobody sees it, and they don't realize that that's where you put your income in to find out how much of a discount you're going to get. So don't worry about the prices that you see, because they are different based on your income. So if you click on the estimate financial help button and you put information in there, this is an example of somebody making $35,000 a year. They're going to get $700 a month to lower their health insurance premiums. That means that a lot of the bronze plans, which is the lowest level of coverage, are going to be free for this person. So when you're looking at these plans, I see this on Facebook all the time. People say, all right, somebody tell me the name of a good insurance company because I hate mine. There's no good insurance companies. They all want your money. That's what they're designed to do, is make money off of you. So there's not one that's better than the other. You have to understand how you use the healthcare system. You have to understand your budget and what your doctors are in network with. And that's how you're going to come to a decision about what plan is the right plan for you. If you've never heard of the company, but your doctors are in network, it fits your budget, and the level of coverage is right for you, then that's the company that you should go with. I do really recommend that people take out a piece of paper and write down how they've used the healthcare system in the last year. Sometimes it's surprising to people how many kind of touch points they've had with the healthcare system. How many times did you go to urgent care? How many times did you pick up medication? What did it cost? How many times did you get lab work? How many times do you see your therapist? These are all ways that you're using the healthcare system. So you want to be aware of those things, because that's going to help you figure out what level of coverage you should get. And these are the different levels. So you have bronze, which is the lowest, and platinum, which is the highest. Bronze is the right plan if you don't believe in Western medicine, never go see the doctor, and just want to make sure that if something horrible happens, you have that out-of-pocket cap that we were talking about of $9,450. That means that if you get a $250,000 bill, you're not going to be responsible for it, right? So the bronze plan is really just there. It's a catastrophic plan to make sure that you don't hemorrhage money, a lot of money, if something goes really wrong. The platinum plan is the opposite end of the spectrum. You are somebody that is going through a hip operation, chemotherapy, you're pregnant, you have medications that cost $3,000 a month. You are a high user of the healthcare system or a frequent user of the healthcare system, and you know that you need more comprehensive coverage. Platinum plan out-of-pocket maximums are much lower than the bronze plan. So they might be $2,000, $3,000, or $4,000 a year instead of over $9,000 a year. You are paying more every month for a platinum plan, but most of them, or I should say many of them, don't have deductibles at all. Whereas the bronze plan generally has deductibles in the $4,000 to $5,000 range. Silver is considered mid-range. So this one balances deductibles and monthly premiums. A silver plan candidate might be somebody who doesn't have anything major going on, but needs to see a specialist a couple times a year, has a few medications that they're on, etc. In order to get the most bang for your buck, you should probably understand the difference between standard and non-standard plans. So you will see on the marketplace, in the names, you'll see either ST or NS. Standard plans have to look exactly the same regardless of the insurance company that sells them. In other words, the benefits are exactly the same. Prices are different, insurance networks are different, but the benefits are exactly the same. On standard plans, the deductibles apply to everything. There are a few exceptions. At the silver level, the deductible does not apply to medications, And at the bronze level, you get 3 office visits at a copay. But otherwise, everything, the deductible applies to everything. Non-standard plans offer certain common benefits that are not subject to the deductible. And that's generally where I like to start. So if you know that you need to see your doctor a couple times a year and you need lab work, you're going to look for a plan where doctor's visits and lab work are not subject to the deductible. You just have a copay or you just have co-insurance. That's going to be a better plan for you because you can actually use it without having to pay full price. So we're getting to the end of the presentation. I'm just talk a little bit about being uninsured, and then I am excited to answer any of your questions. So if you're uninsured in New York, there are 2 programs that cover you. They're administered through public hospitals. Public hospitals are hospitals that get money from the federal government to see you if you're uninsured and lower your costs. Public hospitals include Woodhull, Bellevue, Harlem, Gouverneur, Elmhurst. There are public hospitals in every county. In fact, New York is pretty lucky in terms of public hospitals. There are some counties in the United States that have no public hospitals. We have quite a few, but New York Presbyterian, Lenox Hill, NYU are not public hospitals. So if you're uninsured, you're going to want to go to the public hospitals, and they participate in 2 programs, NYC Care and HHC Options. You can go to nyccare.nyc. And it's a pretty great website. It reviews all of the information about this program and how you can get care on a sliding scale basis. If you live in New Jersey or in any of the other states, you're going to go to essentialhospitals.org and you're going to click on the tab that says Our Members, and that's where you can see public hospitals that are mandated to see people who are uninsured. You can find out a lot about medication and get medications for free at 2 websites, Needy Meds and GoodRx.com. So Needy Meds is a really great website. Needy Meds is a really great website that will show you all the pharmaceutical assistance programs that are out there. Those programs give drugs away for free to people who are uninsured and have lower incomes. Each pharma company can make up their own rules, but most of them say you have to be uninsured, and most of them say your income has to be somewhere between 3 and 4 times the federal poverty level, which means somewhere between $45,000 and $60,000 a year. In that situation, you can apply to the pharmaceutical company that makes the drug that you're on and say, here's my application, here's the doctor's prescription, I think I'm eligible, send me the medication for free. And they will do that. Needy Meds is also great in terms of finding sliding scale clinics. So if you don't need to go to a hospital, but maybe you need to see a doctor, Needy Meds has a list of all of the sliding scale clinics in the United States, including some pretty common ones that you might have heard of in New York, like Ryan Chelsea Clinton, Callan Lord, etc. You can also compare drug prices at GoodRx. So this is a good place to find the cost of your medication. GoodRx compares the prices of drugs at different pharmacies. A lot of people don't realize that pharmacies charge different prices for the same drug. So you can see here that Target charges $61 normally for Lexapro. Walgreens charges almost 3 times as much. So if you are uninsured, or if you are on a bronze plan, let's say, where you have a deductible that applies to your medication, you're going to want to go to the pharmacy that charges the least amount for your medication. So you can find that at GoodRx. You can also get discount coupons. This is perfectly legitimate. There's nothing weird about this. Pharmaceutical companies give discount coupons to people, and then you can see what the discount is, and they'll apply it when you pick up your medication. One last word, I just want to let people know that we have a really great health center in Times Square that we run with Mount Sinai doctors. It's called the Friedman Center for the Performing Arts. You can call us at 212-930-7300. You can also make an appointment through ZocDoc. We have internal and family medicine doctors, really fabulous gynecologist, a podiatrist. We're open late Monday through Thursday, and we're open on Saturdays, and we take a lot of different types of insurance. We also will see people who are uninsured and in the performing arts industry at a discounted rate. So this is a program that's sponsored by Broadway Cares, Equity Fights AIDS, and by the Lab BioReference. And if you're eligible, you can come to our health center for $40 and the lab work will be free. In order to be eligible, you have to show that you make more than the essential plan limit, because if you make less than that, you should be on one of those government programs. That's a better deal for you. But you also have to show that you've made at least $3,000 in the performing arts industry in 3 out of the last 5 years. And that is it. I am happy to answer any questions.
Thank you. I was just saying thank you. Thank you for walking us through that. I know that was so much information to download, folks.
I know.
And I thank you for just going through each item and explaining everything. I do have some questions that came up. Also, I think you can, so I can't see anything on your screen share right now. I think you can stop sharing if you want.
Yeah, sure.
You can kind of be here together.
Mm-hmm.
Okay, let me go back to my notes. Okay. The first question was, isn't it recommended to get to enroll in health insurance by December 15th in order to ensure coverage starting on January 1st? Is that true?
Yes, it's true in most cases. So if you want your coverage to start January 1 and you are not losing your insurance through an employer, you need to sign up by December 15th. If you are losing insurance through an employer, you have until the end of the month to sign up for January 1.
Excellent. Good to know. Okay, let me pull up, just making sure I've collected everyone's questions. Okay.
Sure.
The next question that came through was, the New York marketplace specifically asks you to provide proof of legal immigration status, or this person has seen that they have asked for proof of citizenship. Is that true? Or
only if you are not a citizen. So if you are a non-citizen, if you are, for example, here on some kind of visa, then you do need to provide proof by putting in the numbers from your immigration document. Otherwise, you do not need to provide proof of citizenship or of documented status.
Okay, great. That was the next question is, if not, do you know of any options for undocumented individuals? But it sounds like this is an option still.
So in terms of undocumented individuals, there's a couple things. So people who are undocumented are eligible for emergency Medicaid, which means that you are in an emergency situation where you need to be in the ER, and then Medicaid will cover you. Not health insurance, but it will cover a life-threatening emergency. Undocumented immigrants are eligible for, if you're pregnant or a child, you're eligible for certain types of limited insurance, and you can also buy a plan on the marketplace.
Excellent. Okay, our next question is, I've heard of people trying to avoid having to take Medicaid because the coverage is worse, or they won't be able to see the doctors they want. Is that true, or do you have any insight on that?
So the coverage is not worse, but it is true that you might not be able to see the doctors you want. So the coverage is actually fantastic. And by fantastic, I mean, there's no other insurance company that's going to pay for car service to and from your chemo treatment. Medicaid does that. They have the broadest formulary of any insurance program. So there's very broad coverage on Medicaid, but Medicaid is a state and federal program. They pay doctors less than private insurance, which means that fewer doctors are in network with it. However, people have it in their minds that you have to go to a Medicaid clinic or a Medicaid doctor. That's not necessarily the case. So doctors take all different types of insurance. If you're going to, let's say, a Park Avenue dermatologist, they might not take any insurance, right? But all hospitals have to take Medicaid in New York State. So if the doctor wants to practice in a hospital, and many doctors do want to practice in hospitals, it's a prestige thing, then the hospital is going to pressure that doctor to accept Medicaid. So all hospitals have to accept Medicaid in New York State. If a doctor wants to practice in the hospital, they're going to get a lot of pressure from the hospital to accept Medicaid. So my advice is to always ask your doctor if they have a hospital practice. If they have a hospital practice, that doesn't mean that they're in there performing surgery. There's all kinds of outpatient options in hospitals. So you can go to a hospital and get outpatient primary care, outpatient urology, outpatient dermatology, whatever you want. So ask your doctor if they have a hospital practice. And if they do, call the hospital practice and ask them if they participate in Medicaid there. That's a better way to find a doctor that you might have the right fit with.
Thank you for clarifying. Yeah, I feel like I learned that yesterday for anyone who was on the mental health call. We were discussing how do you find out if you're a provider you're interested in does like a sliding scale or anything like that. And I also didn't realize that it's all just decided by the provider, really.
Yep, that's right.
Okay, our next question, I think is specifically for the website, the Entertainment Community Fund website. See, the online form to request to get in contact with a health benefit specialist states that it's only for performing arts and entertainment professionals. Is that the case? And is there another way to connect if you're a different type of artist?
So the Artist Health Insurance Resource Center has a separate mandate from the Entertainment Community Fund because we were started with a grant from the NEA. So we see everybody, including visual artists. However, we just launched this new portal, and because every other program only sees performing artists, they didn't want to make a little asterisk and say, and by the way, the Artist Health Insurance Resource Center is different, blah, blah, blah. So you're fine. If you're coming to us for health insurance counseling, we accept anybody in performing or visual arts. Just say that you're a performing artist. We don't care. And then just fill out the application that way. It's totally fine.
Excellent. Thank you for that clarification. That's so helpful. Our next question was from Alberto, and I believe it's also to do with the services you all are offering. He asks, how many navigators are available?
So we have navigators for Medicare and Medicaid. So we have for Medicare and Marketplace coverage. We have 4 Marketplace navigators and 2 Medicare navigators.
Alberta says, thank you. Perfect. And then the next question is just some clarification. So on the Marketplace website, where is it that you find that tiny little income calculator button? Adriana was looking at it and only saw the list of plans with prices.
Yep. Let me just pull that up for you real quick. Hold on. I'm going to actually share my screen with you. 1 second. So here's nystateofhealth.ny.gov. And then you see here, compare plans and estimate cost, this orange button. It's going to default to enter your zip code. So you're going to enter your zip code. You're going to tell them that you're not a robot. You're going to click get started. Now you see this filter. Again, this is a hot mess. I don't know why you can see this is what I was talking about. Here's 42 pages of options. And the prices per month are listed at full cost. But what you're looking for is this estimate financial help button, this blue button right here. So when you click on that blue button, you're going to put in the number of people in your household. Again, this is just people you pay taxes with. Let's say that you're single, and you're an adult, and you put in your income. Let's say it's 35,000. You hit the calculate button. You're going to see it brings up your monthly. Of course, they're not telling you this is monthly. It brings up your monthly advanced premium tax credit. Now what you can do is you can say, okay, I'm looking for an individual plan. And once you've done this and you've selected individual, you click the search button and that changes what you see here. So you can see the Metro Plus health plan at the bronze level. It says you pay 0. So it applies the tax credit, and you can say, okay, great. Let me look at this plan and let me compare it with this Fidelis plan. And then you can look at both of the plans side by side. You can search up to 3 plans. You can see that they're both going to be free at the bronze level at that income level. You can see the annual deductible is $4,600. The out-of-pocket cap is $9,450, etc. So that's how I would use that.
That's amazing. I had no idea.
Everybody says that. I know. That's how bad they are at like marketing this stuff. Yeah. Yeah.
Let's see. Alberto says this moment right here is absolute gold. Or if this moment of using the blue button would be a godsend. Yes. It would be. Okay. Those are all the questions that I saw in the chat. Folks, if you have more, feel free to come off of mute and ask them if you want. You can also put them in. We do have some time left. Of course, we can always end early as well. But yes, there are lots of messages of gratitude in the chat for this.
Good. That's great. Yeah. Again, I'm absolutely happy to answer any questions if they come in. And I can also send you the PDF of the presentation.
That was actually going to be my first question was, might we have this slide deck, which would be wonderful. Renata, if you don't mind just emailing it to me, I will include that in our resource folder. And I see Aaron, welcome, all good, arriving late, no problem. We are recording this and you will receive that in a follow-up email with all the other recordings for this series and a whole folder of all of the slide decks and resources that we have discussed this week. Okay. I'm going to plug our next session while folks maybe are finishing up any questions they may have. Just folks, we have one more session of this series. It is tomorrow. It is called Collective Care with TribeWorks. And it is the same time, same place, same link that you used to get here, 4 to 5:30. I hope to see you there. And just thank you so much, Renata, for taking the time to do this with us. I really appreciate it.
Absolutely. Thank you very much. Good luck, everybody. Take care. All right. Bye-bye.